You're looking at Minneapolis this morning. The high price of insulin there and across the country forcing some families with type 1 diabetes to travel outside the U.S. for the life-saving drug. Last weekend, about a dozen people took a bus 817 miles, think about that, from Minneapolis to London, Ontario to buy insulin. From 2012 to 2016, the price of insulin nearly doubled in the U.S. Mireya Villarreal met the group in Canada.
The group's day-long drive started in Minneapolis, where they boarded a bus to Canada in search of affordable insulin.
Do you guys put in an order on Fridays?
Deb Sowler has lived with type 1 diabetes for 46 years.
For us, insulin is like air. It's like oxygen. We need it.
Deb says she uses 3 vials of insulin a month, and even with insurance, she's paying more than $700 for medicine she can't live without.
It is very, very worrisome, even with insurance, if you only have 1 vial or 2 vials sitting in your refrigerator.
You start to stress.
You do. It's very stressful.
So a lot of people on this bus are from Minnesota, and they traveled about 800 miles to get here. But for them, it's not about the miles. It's about the message.
That's why they drove all the way to London, Ontario, where insulin was developed nearly a century ago.
Getting diagnosed today in 2019 in America with type 1 diabetes, it is a death sentence for some people.
Quinn Nystrom coordinated the trip. It's the second caravan to Canada in 2 months.
This is a 3-month stock. This vial in the United States is $340. This vial today, $30.
It's just because you bought it in Canada.
It's because I bought it in Canada. That's the only difference.
Insulin is cheaper in Canada primarily because the country has public health care. So the government negotiates pricing with drug companies and caps prices. In the United States, drug makers negotiate individually with private insurance companies, and the uninsured pay list price. About 7.5 million Americans rely on insulin to stay alive. The drug is largely supplied by 3 companies who all offer patient assistance programs. In a statement, Novo Nordisk told CBS News, "We recognize that our healthcare system is broken." They added, "We know more must be done to ensure insulin affordability, and we are committed to being part of the solution." But some states are taking their own steps to lower the cost. Florida passed a law that would allow large batches of drugs to be legally imported from Canada into the state, and Colorado capped insulin costs at $100 per monthly supply.
Is this a Democrat-Republican situation?
There's Republicans who are diabetics, there's Democrats who are diabetics, and all of us struggle to afford insulin. To me, this is a human rights issue.
Nystrom says she's lucky to be able to make the trip. Many people couldn't afford to miss work.
Coming to Canada is not a long-term solution. Coming to Canada is putting a Band-Aid on a gunshot wound.
For CBS This Morning, Mireya Villarreal, London, Ontario, Canada.
That price differential is insane.
You see why they make the trip. Like Quinn Nystrom, I like her voice, that little raspy voice. I like that. But she says it's really about getting the message across. Well, they're doing a good job about that.
They sure are.
We're looking at that.
How about hearing a major drug company say, "We recognize our healthcare system is broken"?
It's broken, yeah.
Wow.